Let's get to some common medical questions. Joining us now is News Channel 5's medical specialist, Dr. David Soria. He is also the Chief of Emergency Medicine at Wellington Regional Medical Center. First of all, thank you for coming in, Doc.
Good to see you, Mike.
All right, good to see you as well. Let's get to today's questions. With all the heavy rain that we saw last week, our first question is this. With the West Nile outbreak we're seeing in Texas, could it happen here because of that rain?
Yeah. Well, first of all, the CDC has already declared this to be one of the worst outbreaks in American history. Wow. We're seeing more and more. Now, outside of Texas, we're seeing a couple dozen in North Florida, but can it happen down here? Well, the reality is absolutely.
Yeah.
I mean, all you need are mosquitoes and pooling water. And with the recent storms, we have plenty of pooling water.
Of that.
Now, interestingly, and the Florida Department of Health has made a very interesting observation, and that is that it's become worse over the past several years because of all the foreclosures in Florida. There's all these pools, all this standing water being untended to.
Nobody draining
it. Breeding grounds for mosquitoes. So what do we do to prevent it? Well, a couple of things. Try to stay indoors during dawn or dusk. That's when the mosquitoes come out. Use plenty of repellents and do the best you can to eliminate some of the standing water that's outside your home. Barrels, buckets, things like that. And that'll help try to decrease some of the mosquito population.
Yeah, there's a lot of health questions coming out after the flood waters.
Sure.
Another one, the dirty water, the dead fish we're seeing. Any long-term health effects from that?
You know, it certainly is disgusting. We've talked about some of the short-term effects that we're seeing from the contaminants in the water, like engine oils, animal and human waste, some of the microbes that are in the ground already, bacteria, parasites, viruses, Shigella, Salmonella, E. coli.
You name it.
Just a ton of different things. And some of the diseases that those cause, dysentery, gastroenteritis, infectious allergic reactions, infectious hepatitis. All of that typically is short-term. Now, what are some of the long-term effects? Usually you're going to see long-term effects with massive flooding when river banks break down, levees, or storm surges where there's massive amounts of water that are pooling for a long time, because that disrupts the environment and the ecosystem and allows for vectors of disease and bacteria to accumulate. So what you'll see in addition to the diseases that we just mentioned are things like leptospirosis, cholera, malaria. Then you can also see some psychiatric diseases like post-traumatic stress, depression, things like that. Keep in mind as well that in the soil, the bacteria and some of the contaminants can last for 2 to 3 months after the water recedes. So don't go or don't allow anybody to play in that soil after that.
You know, just to the advice, stay out of flood water.
Without a doubt.
If you can, stay out of it for sure.
Just stay away for a while, because it's going to take a while for all these contaminants to clear.
That's Dr. Soria. Thank you for coming in, sir. And if you have a question for Doctor, you can send it in by going to our website, WPTV.com. Click on the health link, then scroll down on the right-hand side, and you'll see a form to write your question. And we'll be right back.